I'm going to call our meeting to order. And I will start actually with something that I think we were supposed to be doing this whole time, which is a roll call to recognize which members are actually present in the meeting. Um, everyone who has read the bylaws knows that we need to have at least 7 members to meet quorum. Um, and so I should have been and will be doing in the future, naming all of the members of our board who are present. So when I call your name, if you could just indicate that you're present or here, that would be great. Um, Kristen Simpson,
Present.
Brittany Jones,
Present.
Chris Daly,
Present.
Enbel Shockham,
Here.
Elizabeth Wright,
Present.
Melissa Tepe, I believe Dr. Tepe may be at the same time this meeting is taking place, trying to see some patients. So I see that she has logged in. Mm, that should give us quorum with voting members, including myself, April Jolly. All right.
Hey, April,
well,
it's
our
Deidre. I just wanted to say present. I know I may not be on the
hello,
list
hello.
yet.
Hello,
But
hello. Yes.
hello.
And we are looking forward to hearing a little bit about you in just a couple of minutes.
Oh, okay. Sorry, thanks.
All right. Our next item on the agenda is to vote on approval of the July 17th, 2025 Zoom video as our meeting minutes. Do I have a motion to approve the July Zoom video?
Motion to approve July Zoom video as meeting minutes.
Is there a second?
Second.
All board members in favor, say aye.
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 Anyone opposed? Motion passes. Those minutes have now been approved. Our next agenda item is to introduce our newly appointed Board of Health members. We have one of those folks in this meeting now, and Nebu Kolencherry will be present for next month's meeting, but wanted everyone to get a chance to meet and greet our newest member of the board, Deidre Griffith, and welcome her. Yay! Deidre, would you like to say a few words about yourself and what you are looking forward to about serving on this board, and maybe what you do professionally?
Yes. Hi, April. Good to see you. And it's great to see so many familiar faces. I know many of you have known some of you for many years, being leaders in public health. So, yes, I'm Deidre Griffith. Currently serve as Vice President of Community Health Improvement for BJC Health System. I've been in that role about 2.5 years now, and it's been an amazing experience. I lead the system-wide strategy to address highest priority community health needs. We work very closely internally with all of our hospitals to address those needs, and also very closely with community-based partners. So I won't go into the detail. It'll take the whole hour or so to talk about our strategy, but I look forward to sharing more. And this actually, I'll just quickly summarize it. This year is my 25th year in public health. So it has been very special, this appointment being part of a lot of milestones that I'm very proud to have reached in my 25th year. So I'm looking forward to serving with you all, continuing to address our community health needs and learning more about the work you all do, and just continuing to advance health equity in our region. So I think I'll stop with that, April, and just look forward to sharing and learning more.
Well, thank you so very much. I am thrilled that you are now a member of the board, and certainly am looking forward to working with you more as we carry out our board's work. So thank you so much for joining. All right, we're gonna move into the next section of our meeting, and I am excited that we get to hear directly from Department of Health staff about several areas that we've had either questions about or we're just due for updates. So I will turn it over to our Commissioner of Health, Victoria Onwurrie, and
Good morning, everyone. Thank you, April. And Deidre, welcome to the board. We've known each other, I think, all 25 years. So
Say yes, all 25 years, Victoria.
it's wonderful to have you on the board. Thank you, April. So we're going to go ahead and get started on our presentation. I'm going to start out with a few introductory slides, and then Matt Haslam will take it from there. So the Department of Health was asked to speak on our response during the recovery effort after the tornado on May 19th, May 16th. And our response has been vast and very impactful. So an E16 tornado hit the St. Louis area, or EF3 tornado hit the St. Louis area on May 16th. And the department was immediately involved in many areas, including providing health information materials around cleanup and debris, canvassing community to assess needs. We were actively involved in the Emergency Operations Center activities. We provided immediate provided immediate health needs when possible during canvassing. We linked people to critical health resources, including behavioral health. And then we also stood up our formal health command, which enabled us to really systematically look at the ways that the Department of Health could respond. So this report kind of outlines the public health response and some of the health issues that we saw during the tornado. So in May, as soon as after the tornado hit, we were immediately deployed to the Emergency Operations Center. We put out consistent messaging around debris cleanup, cleanup safety, air pollution or air quality related to sort of the buildings that were damaged. In June, we also stood up our health command, which I mentioned, and we deployed health assessments and door-to-door outreach, particularly during the heat wave, which happened, I think, 3 weeks into the tornado, to make sure that individuals whose homes were damaged had information about cooling resources in the area. We conducted active surveillance for heat as well as behavioral health. Our behavioral health center was really on the ground from day one, really just responding to the crisis counseling and providing that immediate behavioral health relief for individuals that were impacted by the tornado. We've set up misting stations during the heat wave that happened during the middle of the tornado. So what that involved was identifying gap areas where there were cooling centers. So the city puts up cooling centers around the area, which are every year in the summer, cooling centers are put out with their libraries and public places where people can go to stay cool during the heat waves. And there were critical gaps in the tornado area where there were, miles apart from cooling centers. So we put up these misting stations, which are basically A-frames with water spewing that kids can go and find relief from the summer heat. We put out messaging around mold with all the rain that was coming, debris cleanup and safety, and that sort of thing. And then now the mayor's office has moved into a recovery phase, so the tornado response is no longer being led by the Emergency Operations Center, but through a new office that was established by the mayor called the Recovery Office, of which the Department of Health is a part of and actively participating in the Resident Wellbeing Task Force, alongside of Dr. Adam Pearson, who directs the Department of Health and Senior Services here for the city. So we continue to be involved in many ways, including getting ready for providing health information during the demolition phases that are potentially coming of resident homes. So I'll stop there. I believe the next slides are our actual response and the health data that we found. So I'm going to turn it over to Matt Haslam, who is one of our senior epidemiologists here at the Department of Health.
Thanks, Commissioner. Nice to meet you all. I see some familiar faces, but it's been a while since I've presented to the board. So thanks for having me back. And I'm just going to walk through sometimes very quickly. There's quite a few points I want to hit, but some of the surveillance and response data that we've been looking at as part of the health department. So I'm sure you've seen this map before, but this is just to level set. This is the tornado impact response zone, or zones A, B, and C. For the purposes of this, I've combined them all into the one impact zone. And that gray path is the tornado path. And then this is just some high-level demographics for the area. So it's about 30,000 housing units in the area. Of those, about 3/4 of those are occupied and a quarter are vacant. Of the occupied households, about a third are owner occupied. This is a region with about 2/3 Black and a little bit less than a quarter white, filled in by the other racial groups. I'll just kind of breeze through that. So one of the major things that we were worried about directly after the tornado was air quality. So we looked at the EPA and Missouri Department of Natural Resources permanent air quality monitors. So 3 sites were sort of directly in the impact area. So that's Branch Street, Blair Street, and Forest Park. And then we compared those readings to 4 control sites, if you will, that were relatively nearby, but outside of the direct impact area. So those are Arnold West, Ladue, Maryland Heights, and South Broadway. And we're looking at large particulate matter, so PM10, fine particulate matter, PM2.5, and ozone. And then, as the commissioner mentioned, we did have a little bit of data from some standalone air monitors placed at debris sites that were collected and analyzed as well. So skipping over ozone, the results are not all that interesting. It's relatively normal. Large particulate matter, again, mostly normal. This dashed line here at 100 is kind of the threshold for healthy air to starting to get more and more unhealthy. And you can see the red line is the tornado, day of the tornado. And then Branch Street in particular had this large peak on June 3rd. Several other spikes here occurred as well, and some of them kind of broached that unhealthy threshold. We did discover that near Branch Street, there's a metal sort of industrial activity. And so there's a predictable spike in the late afternoon, early evening. So that could contribute. But this spike was atypical. And remember this date, I'll be coming back to it later. For fine particulate matter, so these are smaller pieces of debris and dust. Again, mostly normal throughout the course, both before and after the tornado. But there was this increasing sort of trend here in late May and early June, as well as 4th of July, which is predictable with all the fireworks, and some wildfire smoke a little bit more recently. And so gray is the control areas that I've averaged together, and that includes Arnold West, Ladue, and South Broadway. And the other colored lines are direct impact monitors. And I haven't shown the data here, but the standalone monitors also showed normal readings. There was a few outliers that were in the unhealthy zone, but those were associated with debris being moved during those days. But otherwise normal at those sites, and there was no asbestos detected at any of the monitors on any day, which is a great sign. So moving into some of the sort of hospital data and EMS data. So we have two data sources that have been very helpful. So that's EMS calls for service, and we're able to view those through a platform managed by the fire department. And this contains near real-time information about EMS transports and dispatch. And quite a bit of record level information, including the primary clinical impression. And these are nice because we can see a little bit further upstream from the hospitals, where it includes calls that don't require transport. They might be treated in the field or resolved there. And then Essence is a syndromic surveillance system managed by the Missouri State Department of Health and Human Services. Again, it contains near real-time information. There's sometimes a lag of about 24 hours, but it's pretty good. And this includes information about syndromes or subsyndromes. And you can look for those for diagnoses. So if you get a swab and you test positive for flu, for example, that will show up in the data. But also you can look for symptoms or symptomology, right? So for influenza-like illness, you might be captured in the system if you get a diagnosis code, or if you have cough and fever, and that fever is not explained by some other condition. So it casts a little bit of a broader net for surveillance purposes. And this system is nice because it has algorithms in the background that will flag unexpectedly high case counts, so you can review those. So we'll be looking at each of those data sources a little bit. So for EMS calls, I've kind of blocked them out into three sort of time frames. One is before the tornado or pre-tornado, and that's from April 18th to just before the tornado. Calling the post phase the acute phase, and that's about 6 weeks after the tornado, and then the recovery phase, for lack of a better word. And I should note that this recovery tag does not line up with what the commissioner mentioned about the mayor's sort of declaration or stance that we're moving into recovery phase. So just wanted to tease that out in your mind. But in any case, the race, ethnicity, gender distribution was pretty normal, and it didn't really change pre and post, but age did. And I'm highlighting that on the graph here. So the graph pre-tornado shows this gray line, and it's the age distribution of EMS calls by the percent of calls. So in the, say, the 30 to 39 year age range, there's about 17 or 18% of those calls were in that age range. And you can see directly after the tornado, or the 6 weeks after the tornado, this age distribution really shifted to the right towards the older population. So those age 60 to 69. So our senior residents in the impact zone were largely affected. And that distribution is shifting a bit back towards sort of the baseline, the pre-tornado age demographics. For calls for service, the volume graph is shown here on the left, and these are 2-week timeframes. And this third band here is the week of the tornado, or the 2 weeks following the tornado, and you can see that the proportion of EMS calls in the impact zone increased proportionally quite a bit following the tornado, and then that's kind of slowly returned to baseline as well. So we're more or less back to normal in terms of what we'd expect from EMS dispatch geographically. And then this graph, there's a lot going on here. I'm not going to go through all of it, but on the left-hand side, it shows primary impression, the top 10 primary impressions within the response zone. And then on the right-hand side is outside the response zone. That's basically everywhere else in the city. And again, the demographics for both those places differ quite a bit. So, keep that in mind. But there are a few things I'd like to just highlight in this. Number one being across the whole city, behavioral health is far and away the most common reason for EMS calls. And that did increase by a reasonable amount following the tornado, both within the impact zone, which had a larger impact, and a little bit also outside the response zone. Injury, as you can imagine, with crushing injuries or being hit by debris, also increased, and that has fallen a little bit since. Interestingly, shortness of breath or respiratory issues had a pretty high proportion before the tornado, and that actually fell after the tornado, which is a bit of an unexpected finding. Another one that was a little bit of cause for alarm is this metabolic category, which is essentially diabetes, hypo and hyperglycemia. And this is cause for concern because it might indicate that people aren't getting the insulin that they need or their prescriptions to keep on top of their health management. And then another area of concern, this is another thing that the commissioner alluded to, is the heat waves. And so we took a particular focus on the heat exhaustion and dehydration. And you can see with the heat waves moving into further and further into the summer, that did increase over time. So now we're looking at Essence data, which is the syndromic surveillance information. And I've kind of blocked out a few different events here. So the gray band is the day of the tornado. And then each of these sort of areas is the heat advisories or heat waves that we've experienced in St. Louis, just to highlight those time periods. So asthma and shortness of breath saw some temporary spikes on June 4th. If you recall, the PM10, large particulate matter, did spike the day before that. So there might be a correlation there. And then again on June 14th to 16th saw this increase, and that coincided with small particulate matter increasing around that time. So a bit interesting that peaked there. But if you look at overall respiratory conditions, they have been on a slow downward slope for since the tornado, actually. So a bit of an unexpected finding there. With heat waves, and just in general, we'd like to take a look at these to make sure that there's no unusual findings. But during heat waves in particular, heat can exacerbate some of these conditions like cardiac and circulatory issues, chronic kidney diseases, and metabolic disorders. I've taken metabolic disorder graph off here. I thought it was too busy. So I'll change that title. But just looking at cardiac and circulatory and kidney disease, mostly normal. Following the tornado, there were a couple outliers here that flagged a warning label in the system, but otherwise normal. I do want to draw your attention though to the heat waves. So we did see from this a mild positive correlation between these heat waves and increasing circulatory events, and as well as kidney disease events. So it's within normal ranges, except for one July 30th there for kidney disease, but kind of an interesting visual finding there that during the heat waves, those conditions did increase slightly, but not to unexpected levels. And then for mental and behavioral health, on the left-hand side is mental health conditions, ER visits for mental health conditions excluding overdose. And then the right-hand side is ER visits for overdose. Again, after the tornado, there was an increase after that event with behavioral health total volume, and it did stay elevated for a while, but has been dipping recently. So that's a good sign. Drug overdose, on the other hand, has kind of shown a more erratic pattern that hasn't really been associated with the heat, although there was the biggest spike just after the longest heat wave there in July. So we do have a heat dashboard, and we do track cases for heat quite closely. And from April to yesterday, we've had 196 emergency room visits for heat-related illnesses. And these have disproportionately affected Black residents, in particular male Black residents, and those aged 45 to 64, and then over 65 as well. Geographically, downtown and then some of the north side zip codes have been hit the hardest for the number of emergency room visits for heat-related illness. And again, these dates for the heat advisories are here. And those periods accounted for roughly 2/3 of all emergency room visits for heat. One thing that we also were concerned about right from the get-go is mold and fungal infections. As the commissioner mentioned, we did have some rain after the tornado, and mold is all around us in the soil and environment. And typically it doesn't cause harm, but in those kind of disrupted soil circumstances, it can kick up more of it. And of particular concern, after the May 2011 Category 5 tornado hit Joplin, Missouri, there were some findings of some rare fungal infections. And of the 13 that were identified, 5 patients died. So that was quite a high mortality rate. So that was of particular concern here. So some of the fungal infections that we were monitoring include mucormycosis, which is this particularly deadly one. And then some of the more common ones, histoplasmosis, blastomycosis, and valley fever. This essence graph shows the fungal infection ER count for the city, and they have increased, but I looked into these, and these include all fungal infections, these mycoses, and most of them are candidiasis, so that's a yeast infection or diaper rash, which are pretty normal, or other sort of skin infections, rather than the more serious pneumonia or meningitis that we'd be more particularly worried about. Although there were a few cases of histoplasmosis and aspergillosis, but the rate of those diagnoses was not particularly different from before the tornado hit. And then Legionella is a bacteria found in natural water sources. And again, it typically doesn't cause infection, but every so often it can cause disease, pneumonia or Pontiac fever. And so some common sources include aerosolization, exposure via misters or water coolers. And so, or, in mold and sort of mildewed abandoned buildings or damaged buildings. So after the tornado, that was a big concern because we had both the damaged buildings and also during the heat waves, we had those misters going. And we got identified, we were notified of 8 cases of Legionellosis in a relatively short time period following the tornado. So there was some concern that those cases might be related to some of those misters or cooling stations or hygiene facilities. So we did some investigation there, and our disease investigators did a great job trying to collect information from patients. And on the map here, I've got the zip codes where cases were identified, highlighted. And you can see that most of them are actually not in the impact zone. And there's no spatial relationship with the misters or spas or shelters. So I just wanted to highlight this as a kind of a good example of when public health is doing its due diligence and doing quite a bit of effort to get to the bottom of exposure. And sometimes it doesn't lead anywhere. It's a negative finding, and that's actually a good thing, right? So we've done our due diligence to make sure it's not related to these things. So just wanted to highlight that as a work that we're doing behind the scenes that may not always get the praise, but our disease investigators have done a terrific job. And just up in the top here is the yearly diagnoses of Legionellosis. And you can see there's 8 year to date here, but it's within sort of the historical trend over the last 5 years. For vector-borne diseases, so these are mosquito-borne or tick-borne, we've seen an increasing amount of diagnoses year to year, especially in the last 2 years. So 2024 saw 24 total vector-borne conditions. In blue, I've got January through August of each year, and then the gray is kind of filling out the rest of that year, so the total. And you can see that we already have 22 cases of vector-borne diseases this year already, so we're poised to surpass the 5-year maximum already. Last year's vector-borne diseases were largely driven by tick-borne diseases, so Lyme or ehrlichiosis. This year, it's more of an even mix of both tick and mosquito-borne. And on the right-hand graph, we have West Nile virus. And you can see there's been quite a dramatic increase since 2020, which had 0 cases. And now we're up to 8 cases. 5 of those are neuroinvasive this year. So we've seen a higher than usual activity of West Nile virus. Okay, so that rounds out the EMS and the Essence data that we've been looking at, and just general disease surveillance. And so another thing that was done was canvassing by UMSL 211 and others. So there were more than 10,000 surveys completed by residents in the city. And of those, about 1,700, a little bit more than 1,700, indicated a health need. And so the survey was asking people what their most immediate needs are. And primarily it was geared towards meeting people's needs. And most people filled out that they had building damage and they needed support with tarping or debris cleanup, or with food supplies, replacing household goods, et cetera. But just showing the health needs here. And so the most common health need was assistance acquiring prescription medication. So they'd lost their medication and needed a refill. So that was a little less than 1 in 5 respondents that indicated a health need had that request. And that was about 3% of the total respondents. Functional needs assistance was also common at about 15%. And then many other people requested less urgent non-prescription medical supplies, so like first aid kits, Advil for pain management, et cetera. And then further down on the list was direct healthcare access or treatment, and then some behavioral health needs as well. And then moving into some of the great work done by our environmental health services. So food and beverage control is one of our bureaus, I guess, within the Environmental Health Bureau. And so they've issued embargoes and destroyed food at 3 food establishments within the impact area. They've completed phone and in-person canvassing for all 219 food establishments in the response zone. And then 20 food establishments remain closed due to damage, and that includes 9 restaurants, 6 SLPS schools, a grocery store, senior center, a bar, a daycare, and a nursing home. And then on the right-hand side are Citizen Service Bureau service requests directed towards food and beverage. And then pre and post tornado, the percent of service requests ranked. So you can see that, before the tornado, food establishment problems and foodborne illness were the top 2 requests, but afterwards, rats and mice were the top concern at 30%. So it's quite a big increase. Community sanitation also has been doing a lot of great work. They've also completed a lot of canvassing, so phone and in person. They've visited 4 lodging establishments, 16 public pools, and 45 childcare establishments within the zone. Pardon me. One of those lodging establishments remains open. 12 pools were damaged and 2 remain closed. And then 29 of those childcare establishments were impacted, with 13 being damaged. But all but 1 have reopened, which is great news. And with extenuating circumstances, we are extending time periods for compliance and maintaining regular communication to make sure that people come up to the expected standards, but there is a bit of grace being extended here. And again, CSB requests for community sanitation, so commercial dumpsters or wastewater in the basement were the pre-tornado most common top two, and then afterwards roach infestation has kind of taken the lead there, and that's overtaken the communal dumpster. So these infestations of both rat and roaches has upticked. And then lastly, for EHS, we've got animal care and control. They are always very busy. And so they've been out and about conducting extra patrols in their tornado response zone. And they provided temporary shelter for pets in partnership with the Humane Society.
It looks like Matt may be frozen.
That looks like he's frozen. So, so you can see that I'll just continue until he gets back up. Stray dogs continue to be pre and post tornado, the highest CSB reports. And then the maps on the right-hand side show the CSB service requests pre and post tornado. To the next.
Victoria, where is the temporary shelter? Sorry, this is personal. I'm in the impacted zone and we did lose a cat, or sweet cat, after the tornado. I'm just curious. Do you know where that is? Or maybe Matt can share when he gets back.
Dante, can you pull the slides up? Over.
Sure, stand by.
Matt dropped. I'm sorry, Deidre, I didn't hear which location did you?
Sorry, you said it was a temporary shelter for pets, lost pets. I was sharing, I'm asking for a personal reason because I'm in the impacted zone and we did lose our cat in the tornado. So at this point, you know, we're thinking it's, you know, she's gone, but I don't think I realized there was a temporary shelter. If I can find out the address, that would be great. And I can ping you offline.
Let me try to find the slides.
Thanks.
I have them. I just want to make sure I get to the right slide before I share so we can, I want to say we are.
Oh, Matt, you're back.
Sorry about
Oh, okay.
that. My internet dropped there for a second. What was the last?
So we were on the animal care and control slide.
Okay. Let me get that back up.
Mhm.
And Deidre, I'll follow up with you offline on the location of the shelter.
Okay. Sorry about that. Can you see my screen now?
Yes.
Okay. Apologies. Just to quickly wrap up here. So the animal care and control, very active. Interestingly, though, before the tornado, there's quite a bit of activity in the area, and despite the total count going up post tornado, that activity has shifted southward, which is a bit off screen here. So less activity within the response zone. And then lastly, getting to behavioral health, they've been doing a lot in the community. Their core activities, as was mentioned before, is linkage to care, behavioral health urgent care with their teams providing spiritual counseling and crisis response, education and training, outreach, and then providing Narcan out in the community, some criminal justice response, and then some policy and advocacy. And on the right-hand side, we have a map of mental health referrals received by the Bureau up until the end of June. And this is by census tract. So you can see most of the activity has been within that response zone, and quite a few residents helped there. So some stats as of 8/17, 28,000 individuals have been met by the Behavioral Health Bureau and gotten their needs met. 70% of those have been mental or spiritual care or crisis counseling and trauma. 50% have been linked to housing, wellness checks about 40%, and then food and clothing as well. And those referral sources go through the United Way 211 system, the Integrated Health Network, People's Response, et cetera. I'll let you read them yourself. And then some of the activities include staffing the DRCs. We have 17 hotels housing 291 individuals from 118 different households, and they're responding to those referrals in neighborhoods, doing canvassing and linking people to care. So receiving on average 250 referrals each week, along with about 200 at the DRCs. And the age breakdowns of those, about a third are children, and then seniors age 60 and over, also another third. Heavily female, so 80% female to male. And then on average, about 25 wellness checks per day. And they operate Monday, Thursday, and Friday. So thanks for bearing with me, and that's all I have. Apologize for the brief interruption, and be happy to take any questions.
Matt, thank you so very much for all of this data. I think I have a question about maybe what do you know about the possible downstream or kind of future impacts? So like fine particles in the air can certainly trigger asthma based on maybe what has been seen in places like Joplin or places where there are like forest fires. Is there something that we should be prepping for in terms of expecting to see a increase in some of the health challenges that we know people might either see an increase or
It's a great question. I think it's there's different phases of kind of the health outcomes, right? So the acute phases. Apologies, I've got a little tickle in my throat this morning. We're more concerned about those injuries and the more acute phases, right? But as you move further out from the event, I think some of those more chronic conditions, right? People getting access to care that they need on a routine basis becomes, largely what we're looking at. Getting access to their prescriptions and managing their, diabetes or their hypertension or what have you. One of the observations that we met with Dr. Garza's coalition that he organized to talk to different health leaders and kind of get a sense for what they're seeing. And actually it was fairly shortly after the tornado that things returned more or less to baseline in terms of what people were seeing for ER referrals or inpatient, outpatient care. But what has persisted is the behavioral health concerns. So PTSD or other forms of trauma that are sort of lingering and kind of remain in the community. And those were, even before the tornado, some of our biggest health concerns already. So I'd say behavioral health is probably the biggest concern going forward from a long-term perspective. But then housing and housing instability caused by damage or just displacement also is a big concern. And moving forward, that'll be an issue as well. And those things can impact sort of exposure, right? If you're unhoused or have housing instability, you might be more exposed to heat if you're, to and from different housing options, those kinds of things. Does that kind of answer your question? I think mostly behavioral health at this point, and then more of those chronic conditions.
Yes, thank you. I see there are at least 3 hands raised. I believe I saw Kristen's first, then Enbal, and then Deidre.
Actually, Inbal was before me. You sure? Okay. I'll be honest, I have a lot of questions, but before I get to them, Matt, I just want to thank you for the thoughtfulness of this report and sharing, how public health from the city has been able to deploy and support city residents. I won't ask all of them, but perhaps, for the sake of the agenda and the other important topics we need to get to. But I did have some questions I just need clarified of understanding vocabulary and language that's being used and how that's like centered in the support that the department is offering. So one of the questions I had, and I don't know if this question is for you or the commissioner, Victoria, but I wanted a little more context around what is the Resident Wellbeing Task Force to understand like the charge and how that impacts residents. I'm not familiar with it, and it could just be me, but just wanted to have a little more context. I guess I'll ask all the questions and you can just like jump in. And
Okay.
then the other questions were more context around what is considered a health assessment from the city department. As a medical professional, I have an idea of what I think a health assessment is, and I don't want to make any assumptions. So I wanted to clarify what that is from the city. What is a wellness check? What does that include? And then I think one of my biggest questions is with the city not having clinical services and with this incredible surveillance that you all are uplifting, how are your stakeholders and community partners being looped in to provide? Like, it's one thing to know that there's an issue, and then how are we giving people tangible resources to say, now that we know that there's an uptick in air quality, here's a space that you can go to get that handled, or we have arranged for some sort of mobile clinic that offers that kind of support, obviously for people that can't leave their blocks. Okay, I'll stop there.
Okay. I'll turn some of it over to the commissioner to answer, but I'll try to tackle a few pieces. With regard to the health assessment, so let me scroll back to the 211 assessments. So I will admit some of the structure or the questions I maybe would have done slightly differently if it was me developing the survey. There is some overlap here, like healthcare access or medical treatment and access. So there's some overlap, but those assessments were produced based on previous work from 211 and others, and sort of was used as a centralized way to collect information from residents about their needs. So that's one piece. And then for our environmental health staff, animal care and control will do wellness checks for pets and animals to make sure that they're not being left out in the heat all day during those heat waves, and making sure that they're okay. And then behavioral health, when they're doing canvassing or getting referrals, they'll do assessments to check on well-being. And I'm less familiar with the behavioral health, so I might kick that to the commissioner to get her thoughts. And apologize, trying to think of all your other questions. I'm also going to kick the task force question to her as well.
Yeah, so, and behavioral health wellness checks are really just that, going into the community and seeing how people are doing mentally, providing crisis counseling on the ground, real time, linking people to resources that they may need, including wraparound services. So, mental health is one thing, and then people also, they uncover that they need access to food, or they don't have an AC, and so connecting individuals to organizations that provide those services in a real-time basis. And for heat, when we did outreach for heat, it was literally going door to door in the impacted area, focusing specifically on tarped or tented homes, seeing what people needed, if they knew where cooling centers were, giving them information about the cooling centers. When we had water available, handing out water. We had several people who were living on their porches or in the park because their houses were damaged. So We know that there are a few that we know that we went back the next day and they actually went to the cooling center. So it's just that kind of real time on the ground, checking in on people. So the Resident Wellbeing Task Force, again, is a part of the recovery effort of the city of St. Louis, led by the mayor's office. And the goal is to, so we know that almost 10,000, mostly low-income residents were impacted by the tornado. And now we have multiple unmet needs in terms of well-being, whether it be physical, mental, and long-term care and recovery. So this Resident Wellbeing Task Force, in an ideal state, we want all impacted residents to be able to achieve and maintain long-term physical, mental, spiritual, and spiritual well-being through the effort of this recovery Resident Wellbeing Task Force. So the core lines of effort of this task force are resident recovery and support systems, healthcare, including behavioral, spiritual, and physical, supporting families impacted with children, and then an environmental component to prevent and address any environmental health concerns. So those are the kinds of lines of effort of this task force. So working closely with the COAD, which is the communities organizing after disaster, and there's another one, volunteers organizing after disaster. These are groups that are already in the community that stand up after disasters. So when we have the floods, these groups are, community organizations, including United Way and others, that stand up. And so we're working with them to make sure that there's a coordinated response specifically for the tornado. And it includes several partners, including, in partnership with FEMA, once we get the crisis counseling program here in the city, mental health board, legal services. So it's really just a task force focused on that wraparound coverage for tornado impacted areas. And so it's kind of like, Kristen, keeping in the recovery center, it's keeping the foot on the gas, basically, to continue to support the individuals who are impacted.
Thank
Yeah,
you so
and
much.
then part of the communication that you asked about, we have been doing throughout with flyers and pamphlets about various health conditions. So mold remediation, tetanus, various things that you might see following a disaster like this, and those have been available at the DACs and handed out during those canvassing as well.
Thank you both. Imbal, you want to go?
Thanks. Matt, this is excellent. I just want you to know how excellent this is. Sorry, and thank you. I think that comprehensive response, both from the data to the people on the ground is just great to hear and see. I think I had questions and thoughts about short term, the acute and the longer term. And actually I was thinking about how different the PM10 and the PM 2.5 were before and after, right? Just the levels themselves, they're pretty high generally. And so I wonder, I assumed that there would be a real significant spike, and we saw that. And I think that's probably significant enough for us to be keeping an eye out on the things that are related to that exposure. But it might just be a short-term exposure that doesn't have a longer health outcome or diagnosis. One of the things I was thinking about, though, is in how we can compare to other disasters. Is just thinking that they usually have a wildfire has a longer exposure, and B, what could that look like? So we know for asthma exacerbations might have gone up, but we don't know if there are going to be new diagnoses, or for pregnant people, were they exposed and what happens to their infants when they're born? That's probably not going to be identified. Can you tell us, this is not actually I think this is that murky area. How many people were affected in that particular community? How many people live there across these that were hit? I've seen different numbers, so I was wondering if you knew. And do we know how many are still without power? And thinking about that behavioral health impact is just kind of impossible to imagine when you 3 months later don't have power, don't have housing.
Yeah, so I'd have to get the exact number of households impacted and people impacted. I don't have that off the top of my head right now.
Okay.
Matt, I don't know if you do.
I don't have it off the top of my head. I know
Um,
that the mayor's office and the SLDC has been doing quite a bit of work with the Vacancy Collaborative and other, building to do canvassing and damage assessments. And so I think they've got some more information about like physical property damage. But we'd have to look into the people count and get back to you.
Oh, that's fine. I've just seen different numbers. I was just curious about like I'll say this. The health impacts of this disaster are going to continue to be felt because we can't build the sustainable housing right now, and we haven't responded to the power needs. So it feels wild that you are like the community in this way has to keep pasting it together and hoping that some of these other structures get better faster.
Yeah, absolutely. And that is a concern with the canvassing needs or the 211 surveys, these functional
Right.
needs assistance with devices, right? CPAP machines, things that
Right.
require power. Is definitely a concern. And
And that
that's
needs refrigeration, right? Like all of those
right.
things. Yeah. Yeah. We don't have a solution for that. But Deidre, you do. Sorry, passing it off to you. Yes, please.
Sorry, Emball, even after 25 years. I'm sorry, I don't have the exact solution. But that's why we're all here, of course. I also wanted to thank you, Matt. This is really thorough and impressive data that you've compiled. And thank you, Victoria, for your leadership. This type of data is obviously very empowering for folks like me and everyone on this call. But I say myself because I have to communicate to various stakeholders what the needs are. We actually have a big community benefit committee meeting of our health system, and I will have leadership next month, and I will have leadership from Urban League there and United Way, and we will have our president of behavioral health at this discussion as well. So this behavioral health data that you've shared, I mean, maybe she has all this. She'll mainly be talking about BJC's role, and our behavioral health team has been very embedded and on the ground at the DAC, various community-based locations providing care. And in my conversations with them, it has been very, very high need, and they've been very busy. Everything that your data here is indicating. So my question is, are these slides available to us? Okay, yay.
Yeah, they'll be made available.
Yeah,
Okay, thanks.
we're actually putting out a report, a written report on this as well, so.
Okay, wonderful. I don't need all of them, but obviously there's some of your behavioral health, and then like the map. I've been using a different map actually. The initial one you show, yours is much better than mine. The gray line through. Yeah, that would be really helpful again in just communicating and trying to allocate resources, quite frankly. So I'm very thankful to be a part of this board now, and just be sure BJC plays our part in the recovery process. So I'll look for these slides. Thank you.
Sure thing.
Melissa, I believe your hand is raised.
Yes, thanks, April. Want to echo, thank you. The data is so important. I know it takes a ton of time and resources to get that in and of itself, and in such various facets of health and well-being. So it's so important to have this data so that we can work from it, as people have said. I love the elevation too of, our neighbors in our community often go through various types of challenges regarding housing. Food was brought up, right? Education. And I love the comment on, is this a trigger then to more long-term health consequences that we need to continue to look for, pregnant women or those unborn children or children now that may develop asthma because this was the last trigger they needed, right? In order to have some type of either medical or behavioral health challenge or diagnosis. So I think this is just so important. And I'd love to also hear how we can best advocate for those resources, right? Like as Deidre just was mentioning, like how can we best now take this data, continue the data, and really advocate for the Department of Health, advocate for our partners in housing and the environment, right? And so that the city allocates the correct resources to the correct places so that the neighbors most affected get the help that they need. Thank you.
Thank you, Dr. Tippy. Yeah. So I am plugged in with the mayor's office on the task force. So, I'm going to continue to advocate for the things that we're seeing. I think as a board, just, making sure that your populations that you serve know when there's town halls and participate in town halls about the recovery office to elevate their needs. Just the normal things that we'd love to hear, particularly with the healthcare providers in that call. Anything you're seeing in your clinics related to people impacted in the tornado, elevating that to us to then elevate with the recovery office. Just keeping lines of communication open, I think, is the way to move forward.
Thank you. And I will email offline too. I will say, we saw the spike in asthma and the medications needed, needs for like Tdap, things like that, due to injuries. Now I will say as a clinician myself, I continue to see the housing need. Housing is the biggest thing. There's still so many patients in the community that have unstable housing. And that's what they need the most help with when they come to the medical appointments. And for me, for the most part, that's pregnant women and their children.
Thank you all for just really dialing into everything that Matt has offered us and for asking really thoughtful questions. And what I'm also hearing is sounds like there are possibly opportunities for increased either partnership or data sharing, information sharing, particularly it sounds like between our healthcare systems and federally qualified health centers. So if there is some positive effort there that can be even more than it is now, I hope that this presentation has been helpful to those efforts. I know that we are only 25 minutes away from the end of this meeting. I did not want to stop that presentation because it was so great and we all really needed to hear it. But I do want us to kind of recalibrate how we think we should run the rest of this meeting. Commissioner and Worry, we have 2 additional topics that were slated for you and your team regarding the budget overview and then progress and updates on CHIP. Can I recommend that we move the update on CHIP to the September meeting? And are you comfortable giving still a maybe somewhat briefer update than you planned about the budget? And then Kristen, do you think we can pretty quickly move through committee updates?
I am comfortable, yes, doing the budget presentation. And I think I'm sharing my screen. Is it sharing?
Yes.
You seeing what's on your screen?
It's present, oh, that was presentation view.
Okay, so let me see. I hate Zoom. Okay, here we go. Okay, can you see the presentation view?
Yes.
Okay,
Yes.
so let's go quickly through this. I can figure this out. Okay, so the city's budget submission from FY 25 to FY 26 dropped slightly from 19 million to, or from 35 million to 35,660,000 to 35,500,000. 35,500,400. You know it, you can see the slide. Most of our budget is made up from the trust account, which is the account that is dedicated to public health and safety. The major highlights of the budget this year is that the Health Commissioner's Office is budgeted to receive funds from the trust and rather than its own entity. The same thing happened last year where we reestablished the Health Commissioner's Office and the money was pulled from the trust account. Animal care and controls budget and the requested positions to move the shelter operation in-house was not approved. The animal care and control budget increased by 237,552, but the approved budget line for the shelter contract, which you can see here is 1.7 million, is not enough to match the last shelter provider's contract, which was 1.3 million, nor is it enough to support what the vendor requested from the RFP, which is 1.7 million. So we are in the process of working with the budget division to narrow in on what we can afford from this 1.3, closer to the 1.7 to offer the shelter the next round of funding. So right now we went into contract for 6 months for an amount, and then we are going to be moving money from the trust to figure out how to pay through the rest of the fiscal year. Other highlights include our budget for our evaluation and monitoring of medical care at the City Justice Center, evaluating them against the NCCHC standards dropped from 2.6 million in FY 25 to 863,476 for FY 26. Most of that is due to personnel cuts from that budget. We still have a question open with Department of Corrections to receive additional funding for this work, but it's not right now in our budget. But we will continue our contract with the NCCHC to conduct the evaluation and monitoring. Additionally, 400,000 of the requested budget for inmate medical was instead moved to be covered by the trust. 270,000 for STI testing that was budgeted under communicable disease was not approved, and it was instead moved to be covered by the trust. So what is basically happening is our trust is underwriting some of the activities that were not funded in the budget. I'll just go through high level. This is the director's budget. It increased from 5.4 million to 6 million. This bureau continues to support the department-wide initiative, like our epidemiology department, our community outreach, fiscal operations, and so forth. The Healthcare Trust supports our behavioral health bureau, among other things. So we're going to continue to increase linkage to care and Narcan distribution. Inmate medical, the goal is really just to continue our policy development and audits with the of inmate medical to against NCCHC standards. The Commissioner's Office focuses on strategic planning and tracking, FAB, quality improvement, performance management, performance evaluation, program evaluation, workforce development, and department-wide trainings. Our goal in communicable disease is really just to continue to boost HIV prevention and testing events in FY26, and including self-testing kits and TB, and enhancing our TB testing in our shelter population. Animal care and control, we will continue to contract out these services, and the goals for FY26 include providing new uniforms for our officers and doing audits and SOP development, as well as equipping our vehicles with laptop mounts. Environmental services, we've transitioned to a web-based inspection software. We've continue to expand our electronic payment method, and then we're focusing on professional development opportunities. And I know I'm running through this really fast. For FY26, our family community school health goals are to increase our doula outreach and community participation in our outreach events, as well as training and logistic care through various programs. And that is it. Sorry that was so fast, but let me know if you have any questions.
Kristen, I see your hand raised first.
Always me, right? I did have a question. Thank you so much, Victoria, for sharing the budget. It really helps us see, like, you know, the difference in the years. Happy to see some increases, but also disappointed to see some decreases in areas where I feel like the services were needed. So my one specific question is, do you think the recent challenges that individuals were facing at the City Justice Department are directly impacted by the budget cuts from having resources available for people who are inside of the Justice Center?
So again, the budget that the City Justice Center uses for health is not what's impacted here. This is only our budget for evaluation and monitoring.
Okay, thank you for that clarification. And so with that being said, what are the current efforts for health, and how have they changed, perhaps, and maybe different, maybe the change in administration, or are the same services being provided?
From what we can tell from our evaluation work, the service level is the same as what has been outlined prior. I can't speak to the actual incident that just happened, and there's an ongoing investigation. So, but from what we can tell through the services evaluation, you know, we're doing the work that had been done in the past, or they're doing the same work that had been done in the past.
Okay, thank you.
Deidre?
Sorry.
Deidre? Yeah.
Yes. Victoria, did you say the doula outreach program? Is there a program for doula? I'm just curious because we have a very strong focus on doula integration at BJC. And if there's a specific program, I'd love to learn more.
Yes, we actually have 2 programs for doulas. We have actually some doulas at our Department of Health. So I will connect you with our family community school health team to get more information.
Thanks so much.
Dr. Daly?
Yeah, are we able to receive a copy of the PowerPoints from today?
Sure.
Okay. Thank you.
Dr. Tuppy, I see your hand raised.
Thank you. Thanks, Victoria. When we're talking about STIs and communicable diseases, just want to make sure syphilis is also still on the list, especially for pregnant women and families. And then also I'll send an email offline, but in regards to the doula work, because many of the community health centers have doula initiatives as well. What I can tell you is that we specifically are looking for more cost-effective opportunities for training to maintain our numbers of our doula kind of team and their recertifications needed for Medicaid reimbursement as well. So if there's any opportunity for alignment there, I would greatly appreciate it.
Thank you, Dr. Chappie.
Well, that was, I thought, quite thorough, despite having to speed it up. So thank you. And in the interest of time, I don't see any further questions about this agenda item at this time. So, as I said, I am so sorry that we're going to have to move the CHIP progress and updates to the September 18th meeting. But Kristen, could you please take on the committee updates section, which will need to be quite brief?
Yeah, good morning, everybody. We're going to go over the 3 committees that we have currently as board members that we kind of dispatch out to talk about things that I feel like each board member has expertise in. So first on the agenda, I have Governance and Nominations Committee. And so I'll turn that back over to April to give a short report on what the committee has been doing.
One of our committee members, Colleen, is actually going to be giving that update. Colleen? Unless she's with the patient. She may very well be with the patient. Okay. So there's a few updates from governance. One that you all need to know is that Robert Gatter is stepping down from the board. With the addition of Nebu and Deidre, that means that we will have 1 vacancy on our board on the board of hospitals. Governance is also in the process of looking at our bylaws. This is something that we had talked about doing at some point in the last year, and we plan to bring recommendations for changes to bylaws to the October meeting. This is also a part of a new ordinance, I think 71994, which basically requires all boards to go through bylaws to ensure that we have established rules, policies, and that they are in place by October 31st. This ordinance also requires sunshine law training for members of commissions and boards. Not yet certain how or when the city will be offering that training to us, but we will come back with that information as soon as we have it. And that is it for governance.
Okay, thank you so much.
Question about governance. Could we possibly have someone from the Department of Health come to our next meeting to help out with the bylaws and have their input?
I think it might depend on exactly what we in the governance committee need assistance with. So why don't we talk offline about that, perhaps in our governance committee email thread.
Yep, that works.
Thanks.
Thank you both so much. Next, we have Community Engagement Committee, which I chair for. And update is brief. We meet monthly, and we have been reconnecting with Shantae. So Shantae and I had a one-on-one that was incredible, just kind of updating on the status of where outreach efforts have been. They have definitely been in the streets. And we are beginning to talk about some new launching programming that'll be happening from the outreach perspective. And so with our team, which we have representatives from IHN as well as WashU Pro Bono Clinic and St. Patrick's Center. So just our collective knowledge to be able to share resources and be able to get those resources to people has been strong. So Shantae will be attending our next meeting, which will be in a couple of weeks, to help us kind of streamline how we can utilize our platforms and spaces of work to elevate the work of the Department of Health. Shantae, is there anything that you wanted to add to that?
No, well, actually, I had so much that I wanted to share, but I know for the sake of time, I'll
know.
just save it. So I look forward to being at the meeting in a couple of weeks.
Thank you so much. And any other team members from the community engagement committee want to share something? I want to hold space for your thoughts as well.
No, I think you covered it, Kristen. I'm just looking forward to figuring out how we can work together and really streamline our efforts. So looking forward to that.
All right. Thank you all so much. And then I'm going to hand it over to Dr. Strachan just so that she can report off on academic partnerships.
Hey, we met. It was great. We have a good plan for what we're going to be building on. And so thank you to Commissioner Onwari, who was able to come to our meeting very, very prepared in ways that I was not. I had a different list and it was better. Yours was far better. So we thank you for that. We are going to be prioritizing writing up our best practices for internships from the faculty side to teach faculty and our universities, something that the health department could hand out, but also that we could have in-house at the universities. So making sure that we move forward with interns to be ready and good partners who would for the health department. Also, we're polling health department staff on what projects they might want to work with, and Craig is helping with that. Thank you very much. And then lastly, I'm going to highlight is just a lot more of the focusing on sharing information from the health department to academic institutions and their partners, as well as when there are opportunities from academic institutions about trainings or workshops or things like that, we want to make sure to share widely, as well as publications that are focused on the work here, particularly important to share. Things that should have been done better, but at least we'll start there and then we're going to grow even better. Thanks.
Awesome to hear. Thank you so much for that update. I think if no one has any further questions, we can probably move on to the next agenda item. If that's okay. Okay.
Yes, please.
You want me to just go ahead? Okay.
Yeah.
So the next agenda item is board advocacy update, and this will be a very brief update. As you all know, the board has sent off another letter of advocacy. We did not see, and it's really hard for me to identify, and so maybe the department can help me with this. When they do have public hearings, I feel like unless I'm directly connected to somebody that is kind of talking about them, I don't know until it happens. And then I'm like, oh, like we could have been there. So there was one that happened that we missed, but we were already in the midst of writing an advocacy letter, which we sent on behalf of the board. Our focus was on always going to be on funding. I think it's just, it's incredibly hard to do the work that you all do. And Commissioner Victoria, I salute you for the way that you cover the city on a budget that in a lot of ways is inefficient when you compare it to the national amount that other departments can get for a thriving health department. So congratulations to you for keeping it floating. And so we will always continue to advocate for funding. And as we've been watching the tornado relief and how residents have been impacted, the report that you all showed us today also opened our eyes to a lot of the ways that city government can do more to support. I think the tornado was one of the many ways where we expose kind of the delayed response from city government that does have, some resource in the immediate response from community organizations, and how do we create synergy across the two so that our efforts can be combined and collaborative. So we're still kind of keeping our ear on the ground to hear from public hearing. I reached out to the Board of Aldermen, their leadership, to see when there are public hearings coming up, and they couldn't identify a date, but just told me to be watchful. And so I'm doing the best I can to do that. And in the meantime, we'll continue to think about ideas and opportunities for us to advocate in the interim. Advocacy will always be something we do in the I don't want to say it in the background because it makes it sound like it's less of a priority, but it's going to be a constant priority of board members for those of you who are invested in that level of advocacy. For us to continue to do that alongside the great work that everybody else is doing. So that letter was sent, and that is the update that I have for that. Outside of that, in April, I don't know if you wanted to touch on this. I know there were some questions around us meeting with administration since the new administrative team has came in. And do you want to talk about that briefly?
Sure.
Okay.
Sure. Yeah. So, so prior to Dr. Mati leaving, she had put us in touch with Mayor Spencer's team. Of course, there's been, a lot of other needs that the mayor's office has been focused on, and so we have not yet had a meeting with the mayor. But in the ask, we did ask for a meeting. We have asked for the mayor to possibly come to our meeting as a board, both so that we can get to know more about what her thoughts are on public health and plans for public health funding, and also so that she can hear directly from members of the board. We have made contact with someone in her office who is checking Mayor Spencer's schedule. As soon as we have an update on that, we will, of course, share that with the rest of of this board, and also have made some outreach to Julian Nix, who is the head person in the mayor's office responsible for community transformation and tornado recovery. So we have not yet heard from directly from either Mr. Nix or from Mayor Spencer, but Kristen and I are being diligent in making sure that they are hearing from us.
Who's the contact you guys been contacting with at the office, mayor office?
You want to go ahead?
I was going to say the mayor has a chief of staff, and for Mr. Nix, directly sending emails to him, and I also have his number.
Okay, so just Mr. Nix, you guys been talking with Dr. Nix?
No, we actually have not spoken.
Okay.
Yeah, to clarify, some additional correspondence was sent to a team of people that Dr. Mati introduced us to in her transition. And one of them, which was the chief of staff for the mayor's office, was who recently reached out and said that they would check schedules and get back to us in the midst of the competing priorities that they're navigating. And so.
What's the name of the chief of staff?
Feel like her name is Carol Miller or something.
Casey.
Casey, yeah.
Yes.
And
Milberg.
Okay.
I'm sure someone will correct me if that is not correct.
But this is something that the full board wants. Like, is this something that we agree on, that we would like the mayor to come to one of our meetings?
Well, that's what we have all talked about as a board in the past, and I have not yet heard that folks have different thoughts or feelings.
Yeah, it sounds like we're aligned on the mayor joining us, and thank you, April and Kristen, for making those contacts to get some representation here. We know the mayor is very busy, obviously, with many things, so I appreciate you two taking the lead on coordinating.
Yeah, and just to add to that, as we continue to reach out and do correspondence, if you all have any specific questions that you would like us to elevate, please let us know. I know that they get a lot of influx of emails, and so I'm very cognizant of maybe advocacy coming from different lanes. So if we can continue to have a collective message as a board, just reach out to myself or April and say, hey, like, can I elevate this correspondence? Can we, enact a plan of, deadline of when we would like to meet, all of the things that I've already heard from some of you. Just continue to reach out to myself in April so we can make sure that the connections we have made can remain consistent, if that makes sense.
All right. Well, thank you so much. In the interest of time, I'm going to wrap up our meeting by thanking everyone who was able to come, Department of Health staff who have been working so hard on so many things, and in the midst also presenting some really, really important and I have to say very high quality data to us all. Very thankful for the team that has been built that is able to keep moving public health work forward despite the funding challenges. And I certainly hope to see everyone again at the September 18th meeting. For members of the board, you can certainly expect to get some follow-up from Kristen and from me following this meeting. And I think that is it in terms of announcements. Thank you again, and I'm officially calling this meeting to adjournment at 9:33. Thank you all.